Good morning. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I'm here to provide an update on the district's response to COVID-19. And specifically, we also want to discuss how D.C. residents can make sure young people are getting the regular care they need to stay healthy. Let me start by talking about the testing schedule, COVID-19 testing schedule for the rest of the week. Today, we opened our daytime sites on a 2-hour delay to allow time for setup after taking equipment down due to the anticipation of the tropical storm. And tomorrow, those sites will go back to their regular times. The daytime sites are open from 8 to 12, the afternoon sites from 4 p.m. to 8 p.m. You can always go to coronavirus.dc.gov to check the schedule. The sites are impacted by weather because they're largely outdoors. So if you're noticing that there's inclement weather, you can check the coronavirus.dc.gov for updates on testing schedules. This morning, we reported 45 new cases of COVID-19 in our community. And today, we also display the metrics that DC Health continues to follow, and continue to check coronavirus.dc.gov for where we stand with all of those metrics. Also, just a few weeks ago, we were joined by the DC Hospital Association and the American Heart Association to urge DC residents to continue to seek care for their regular health needs. We talked about don't delay care and don't die of doubt. And we want to continue to emphasize those messages. DC hospitals are operating and they are safe, and it is critical that people stay in touch with their doctors and continue to make and keep their healthcare appointments. We know that heart attacks, strokes, cancer, and all sorts of other diseases don't stop during a pandemic. So please don't delay care. Call your doctors when you are in doubt. Today, we're sharing another important message for DC parents. As we continue through this public health emergency, it continues to be important that children visit with their pediatricians for their well child visits. These appointments are appointment for tracking growth and development, discussing concerns about your child's health, and ensuring your child is up to date on vaccinations. So please stay on track with your well child visits. We spoke about vaccinations last week at our schools announcement, and even though the first day of school will look different, we still need to make sure that children are getting vaccinated to keep children healthy and also to protect vulnerable members of our community. As you see here, last year we had 1,200 cases of measles in the U.S. This was the greatest number of cases in the U.S. since 1992, and since measles was declared eliminated in the year 2000. And I think it's fair to say that one pandemic is enough for us. So please make sure that you're getting your vaccinations. If you have children, make sure your vaccinations are up to date. DC Health points us to the CDC website for the tracker of what vaccinations are due according to age. So please refer to the cdc.gov/vaccines. Parents can also take advantage of a number of school-based health centers around the city. These sites, which you see here, require an appointment, so be sure to call ahead to make an appointment. So with that, I'll turn it over to Dr. Nesbitt about any comments related to seeking care and vaccines.
Thank you, Madam Mayor. We have been working very closely with healthcare providers within the district, and we know some of our parents and families receive care throughout the region. Over the past several weeks and the past month, many of our healthcare providers have been doing a direct outreach to their families to make sure that they know that their doors are open, to let them know that they can come in for well child visits and other preventative healthcare services like vaccinations, to make sure that they stay up to date. Those are very important messages for families to receive and for parents to know that these in-person services are being offered throughout the district in a safe way, so that they can protect their children from these vaccine preventable illnesses, and to make sure that their development is on track. It's critically important that these assessments happen. We know that the social and emotional development of children is critically important. While in many of our schools may be in a virtual learning posture, it is important that their healthcare providers are engaged in their care to be able to point them to some of the services that are offered, not just for their physical health, but also as part of their social and emotional development. And Chancellor Farabee talked about some of those services that are offered, such as the Parent University and other social and emotional development programs that are offered by our Department of Behavioral Health. So all of those things are critically important. We continue to work with our school systems, local education agencies, to communicate to families if their children are not up to date with their school required vaccinations. That will continue to occur regardless of whether or not the child's school is in a virtual or in-person learning posture, because we want all of our students to be able and ready to return to a in-person learning environment as soon as our public health indicators allow for such. We do know that some of our health centers, such as Mary Center, has opened additional locations that are being able to expand access for these vaccinations. Others have created special evening hours or weekend hours to be able to accommodate the demand that we know our families may have, who may have opted back in March and April to delay well child visits. So we want all of our families and parents to know that these services are still critically important during a pandemic. As the mayor has mentioned, one pandemic is enough, and we don't want an epidemic during our pandemic. So thank you, Madam Mayor.
Thank you. Any questions? Yes, sir.
I have a question for Dr. Nesbitt.
Yes, sir.
Get a sense. I've been looking at some of these numbers, and for example, California has, I guess, more cases than anybody in the nation, but New York has a lot higher death rate. The numbers are going up, but it seems like the number of people dying in that universe is going down. Is it because of better care? Is there a learning curve? What are your thoughts as you look at these numbers?
So there are some observations that we are seeing in terms of there's two things that I would say to that. One is, I will always remind you that there are leading and lagging indicators that we measure or we monitor in terms of COVID-19. We always tend to see an increase in the number of cases, followed by an increase in hospitalizations, followed by an increase in deaths. So I'd always remind you to be mindful of that. The second thing that is happening in some jurisdictions is the age group in which incidence is increasing, or the number of cases is increasing, is trending toward younger age groups, where the case fatality rate or mortality rate or death rate may be lower. It doesn't necessarily mean that severe illness or death doesn't occur in younger populations, but the rate at which death occurs in that population may be lower, which could result in lower deaths overall. That doesn't mean that the severity or the what we should say is the how people want to speculate, like, is the strain of the virus less severe? That's not, I wouldn't draw those types of conclusions. What may be happening is that if younger populations are tending to be more impacted, their severity of illness may be less, and their death may be less likely in that age group. We should be mindful, however, that in certain communities, intergenerational households exist. If young people are infected at higher rates and they work in essential services positions, they are going to come into contact with individuals who are elderly, and they can introduce infection into the settings where older individuals live, and widespread transmission can quickly occur. So it is not a benign issue for young people to be the primary spreaders or primary modes of transmission in communities. We still need to be hyper-focused on that and interrupting those chains of infection.
But the question is, are you getting a sense the medical community is getting better at treating people for this now?
So what I would say to that, Sam, is that we will always continue to learn more about the virus. There are a number of studies underway about therapeutic agents that could be used to potentially treat COVID-19. Right now, there are two remdesivir and steroids, in particular dexamethasone, that have been looked at in terms of improving outcomes for individuals. And as more studies are done with the use of these two therapeutic agents, we learn more about the best time to use them for people in terms of if it should be used, if they have better outcomes in terms of very early in an individual's disease process or later in an individual's disease process. Do they have better outcomes if someone has mild disease versus someone having severe disease, which means that they tend to be on a ventilator and hospitalized in an ICU? We still have not seen overwhelming evidence that multiple drugs are decreasing death rates. What we tend to see is that they decrease the length of time that an individual is hospitalized or the amount of time that they recover. Dexamethasone has been shown to decrease mortality in certain individuals who have a very severe form of illness, but we don't have an overwhelming number of drugs that are on the market now, known to what we would say cure, for example, remdesivir. That being said, many of the physicians who are treating them have gained more experience in terms of when it is appropriate to put a patient on a ventilator versus using different forms of oxygen therapy, when giving more information in terms of when to hospitalize individuals for observation versus having people recover at home, which could improve their course. So if that more directly answers your question, as more people, unfortunately, are diagnosed, the opportunities to learn more about the best ways to clinically manage COVID will continue to improve.
Yes, sir.
Have there been more coronavirus cases linked to Holy Comforter St. Cyprian Catholic Church? And has that case made you rethink social distancing rules for places of worship?
Do you have anything else to say about number of cases? We're just continuing. We're continuing to monitor the situation through our contact tracing efforts. Many of the individuals are still under quarantine, monitoring themselves for symptoms, and some will continue to present for testing, and we will continue to follow that case overall.
Has anyone tested positive from that church?
We're continuing to monitor the situation. Yes.
Another contact tracing question. Maryland recently released data showing 44% of new patients have attended family gatherings and 23% attended house parties. Are you keeping track of similar data, and has the district been seeing similar trends there?
Yes, we are continuing to monitor trends related to our contact tracing data. What we are monitoring are things like activities that we've activated in phase 2. In large part, our trends are not dissimilar from what is happening in Maryland and other jurisdictions. And we also see related to our travel advisory that, a sizable proportion of like 10% of our cases are reporting that they had a history of travel within 2 weeks of being diagnosed. We have cases that we've had to report, close to 10 cases that we've had to report of people who traveled while they were actually infectious. And we are having an increasing number of cases that are related, where people have reported that they have been infectious while they were dining, an increasing number of cases of individuals who have reported being infectious while they were in the workplace. So it depends on how health authorities or states are reporting what's in the contact tracing. So there's a difference in terms of whether or not you're looking at their activities in the preceding 2 weeks. So when we look at travel, we look at, did you travel in the preceding 2 weeks where the virus could be incubating and you could potentially show symptoms? And then we look at what were your active activities when you were infectious. And so there's two different particularly specific categories that would be of concern for us.
So you mentioned that you're seeing people who are infectious while dining. Then Abra today has now disciplined dozens of businesses for not complying with social distancing rules. Is this making you rethink permitting indoor dining?
As we discussed, I think a week ago, we are watching very closely several activities. I consider it a watch list. I think it was 5 of them, which I don't have in front of me right now. I'm sure Dr. Nesbitt
It's
remembers
the ones that
that she just mentioned.
But when should we expect any updates on whether you're going to take any action on those?
You just mentioned an action that we're taking, making sure people are following the rules. Yes, sir.
Could I ask both you, Mayor, and Dr. Nesbitt about rapid testing? First, for you, Mayor, Governors Hogan and Northam announced that they are part of an 8-state compact to do bulk purchasing of rapid testing as a way to put pressure on the manufacturers and to get the best deal. DC is not included amongst those 8 states. Can you tell us why? Were you invited? Were you not invited?
I was not invited, but I will certainly follow up with the governors whom I just had a conversation with last week.
So you would like to be part of this?
I would like to learn more to make sure it's something real, and that the considerable buying power of the district could only help a compact that was serious.
And then for Dr. Nesbitt, with rapid testing test results, are those included in the daily numbers that DC is releasing for positive cases? Does DC include rapid test results?
Yes, our regulations require any tests that are conducted related to COVID-19 to be reported to the local health authority. So we received test results through either electronic lab reporting. The vast majority of labs, almost 100% of them, are reporting through electronic lab reporting. And then clinicians who conduct tests in their office using a point of care test, which is what you're referring to as a rapid test, in their office are required to report those tests to us, and they do it through electronic case reporting. Sam?
Mayor, DC Police Union, FOP, released a press release today saying that they have filed a suit in federal court against the city and you and about the police reform law, saying that it is unfair to them. Any reaction you have to this?
I haven't had an opportunity to review the suit, Sam, but it's not uncommon for people to take issue with district laws, and we will review it with our lawyers and pursue a defense of the district. Yes.
So we now know that President Trump is considering having convention activities in the District of Columbia. Would there be an essential worker quarantine exception for people who are traveling from hotspots to work for the Trump convention celebrations?
I don't know that we anticipate any exceptions to the quarantine until we lift the quarantine. But I'm also not familiar with the activities you're referring to.
I think that answers my next question, which is, have you been in discussions with the Trump campaign about possible street blockages or convention protest zones?
No. Although we of course are always planning inaugural activities, and that inauguration planning continues. Yes, sir.
Mayor Bowser, the CFO just released a letter on the revenue estimates. I'm sure you had time to read it because we just got it seconds ago. But it boils down to he is raising a red flag that some things like the property taxes, commercial property taxes are not coming in as quickly, some non-withholding income tax not coming in as quickly. And he projects that if things don't get better, a worst case scenario, particularly with the federal government not providing support, the worst case scenario could be another downward projection of as much as $500 million. And so I'm just wondering, we just went through the budget process with all those massive cuts. What if you have to face another $500 million in cuts?
Well, I think what this letter includes, and while I did just get the letter, we had a briefing about it last week, that the CFO for our current fiscal year, which ends September 30th, which is good news, that I don't think that will be adjusted, that the revenues are coming in according to what we thought through September 30th, based on the April estimate. So that's good news. That won't require any immediate action. What the CFO continues to want more time to evaluate is fiscal 21, which starts on October the 1st and runs through next September 30th, 2021. And I don't think that I'm entirely shocked by the news that we have to watch every bucket of taxes and how those taxes are coming in. And we might expect that every level, from property tax on the commercial side especially, could be affected. So we continue to watch all of those things. So we will balance our budget as is, what we believe we should do and must do, and our law says we must. You are right to say, Mark, that we went through a very intense process to balance 20 and 21 very recently. And I dare say that we've already cut the low-hanging fruit and into some programs and services that are very important and mean a lot to the prosperity of the district. So additional cuts we will feel them and see them if we have to make additional cuts.
Are you already looking to identify potential cuts in the event that happens?
Can you say that again?
Is your team already looking to identify possible areas for cuts in the event that we do have another revenue decline?
We have a budget process that is year-long, Finnet, so we are always anticipating what we need to do in terms of our programs and services. Yes. Yes.
I'm wondering if you could clarify, and I know you've mentioned this in the past, but do you believe that you have the authority to tell private schools and charter schools not to hold in-person classes if you saw that became necessary as a public health component?
In a public health emergency, Mark, as we did in March, we can close any number of businesses or organizations. So yes.
All right, guys.
Thank you.
Okay, ready to go?